हेलो फ्रेंड्स, आज हम बात करेंगे कि यूरिन इन्फेक्शन क्या होता है। इससे पहले हम लोग यूरिन इन्फेक्शन के बारे में कुछ बोलें। सबसे इम्पॉर्टेंट ये चीज़ अंडरस्टैंड करना है कि बाय डेफिनेशन यूरिन इन्फेक्शन या यूटीआई, जिसको सिंपल एक टर्म में बोलते हैं, तो यूटीआई का मतलब है यूरिनरी ट्रैक्ट इन्फेक्शन। इन्फेक्शन चाहे किडनी में हो, यूरेटर में हो, ब्लैडर, प्रोस्टेट या यूरेथ्रा। सो द जनरल टर्म इज़ ए यूटीआई और ए यूरिन इन्फेक्शन। अब दूसरा सवाल ये आता है कि क्या रीज़न्स होते हैं मेल्स में या फीमेल्स में यूरिन इन्फेक्शन होने के। अगर हम मेल में देखें, सबसे कॉमन जो यंगर जनरेशन है उसमें यूरिन इन्फेक्शन होने के मेन रीज़न रहते हैं अगर कोई भी बाय बर्थ कोई ऑब्स्ट्रक्शन हो यूरिनरी ट्यूब में, या कुछ लोगों का फोर स्किन जो है वो बिल्कुल सिकुड़ गया हो, बंद हो गया हो, यूरिन प्रॉपरली ना निकल रहा हो, या फिर कभी ब्लैडर प्रॉपरली काम नहीं कर रहा है, यूरिन खाली नहीं हो रहा है। सो दीज आर द रिस्क फैक्टर इन द यंगर जनरेशन। स्ट्रिक्चर एक और बीमारी है जिसमें यूरेथ्रा का ट्यूब जो है वो नैरो हो जाता है। एल्डरली मेल्स में बहुत कॉमन रीजंस में जैसे आपका बीपीएच है, प्रोस्टेट इनलार्जमेंट, स्ट्रिक्चर, यूरिनरी ब्लैडर स्टोन्स, ये सब रीजंस हैं। दोनों मेल और फीमेल में अगर हम देखें, सो द डायबिटीज़ इज़ द मोस्ट कॉमन रिस्क फैक्टर to have very common urinary tract infections. Female में main reason of urinary tract infection is having a sexual activity, और monthly cycles में vaginal flora का जो the quality and the quantity it changes, and if it leads to the decrease in local immunity, so that can lead to the urinary tract infection. So female sex itself is a risk factor, having because of the anatomical differences and having a sexual activity, hormonal changes in the late age after the menopause, the infection rate goes high. हम किन किन कारण से क्या क्या रिस्क फैक्टर हैं जिनसे यूरिनरी ट्रैक्ट इन्फेक्शन होता है। Clinically, most of the time we categorize into a simple urinary tract infection or a complex urinary tract infection or a complicated urinary tract infection. So simple urinary tract infection means that which refers most of the time infection in the urinary bladder or cystitis. So any infection giving a urinary tract symptoms like आपको बार बार यूरिन जाना है, जलन और frequent urination, as I said, that can point towards the urinary tract infection. When it is complicated by the fever, there is any obstruction related to this fever, we call it as a complicated UTI. And a patient may present with even severe conditions like having a very high grade fever, or sometimes if the infection is in the upper tract, यानी कि kidneys के अंदर है, so the condition can be even worse. So how we make a diagnosis of urinary tract infection? First of all, the best thing is to have a dipstick urine test, which is available even everybody at home. So you have a pre-color matching a dipstick which you can dip into the urine, and then according to the color which they changes, as we do a pregnancy test, you can definitely find out whether you have infection or not. So this is a simple test. We can actually find it at home. If it is a first bout of infection, so you can definitely, take the homemade remedies, try to increase your immunities by taking a probiotics, increase your liquid intake, ताकि आपका infection जो है वो कम हो जाए, bacterial flush हो जाए. Now, if this is a recurrent infection, then obviously we have to have a proper culture, urine culture, एक urine का sample जो हम lab में भेज के एक culture करते हैं, and then we see what is the type of the organism, bacteria which is causing the urine infection. So based on that information, then selective antibiotic course can be, chosen for that particular patients. So I would suggest that if you are in any of the risk factors, like having female itself is a risk factor for urine infection. If you are old and you have a BPH symptom, you are having a risk factor. If you have a diabetes, you are at the risk. If there is any blockage in your urine flow, whether it is due to the stricture, due to the meatal stenosis, due to the stenosis in the foreskin, there is some stones, any calculus or any stones in any of the tract from the kidney to the urethra, you are at a risk of developing the urinary tract infection. So the first and foremost important is to diagnose properly and then treat. However, to prevent the urinary tract infection, you must drink a lot of liquids, because if you drink a lot of liquids, you will flush the system very nicely And what we can do as a home remedy, there are many other home remedies by which you can prevent the recurrent urinary tract infection. Maybe you can use the cranberry juices. You have over-the-counter some medications which can be used to prevent the urinary tract infection. The best is always using the probiotics. Curd is one important thing which increases the lactobacillus in your body, which can prevent the recurrent infections. So I hope that this video was useful for you. Thank you for watching this video.